There are a number of patients who end up failing a number of migraine medications for various reasons. And sometimes it's just you haven't found the right fit for the right person. Sometimes you have to use a combination of treatments. There are definitely patients who end up using maybe 2 or even 3 preventative treatments to actually attain some kind of control over their migraines. Sometimes it's just that you haven't found the right fit, and sometimes it's just that the patient actually needs a little bit more. There's definitely a treatment ladder in terms of treating migraine. If you have just a few very mild migraines a month and they respond to something over the counter like an NSAID, you can definitely stay with that. But if they progress to become a little bit more intractable, it may be an option at that point to introduce either a migraine-specific acute treatment or even add a preventative medication. And if that doesn't work, then you explore the injectable options, either the monoclonal antibodies or the botulism derivatives. When you go to see your doctor regarding your migraines, you should definitely try to have some idea of how often they're occurring and how bad they really are. I think that's really the most important thing, is to really kind of assess the degree of migraine disability. Other factors you may want to bring up to your doctor are triggers, things that tend to set off your migraines. You may also want to speak to your doctor about things like difficulty sleeping, because some migraine medications may be able to target that as well, and other medical issues that you may have as well that may respond to the migraine treatments. In general, doctors recommend keeping a headache diary because it's often very hard for people to recall how bad their migraines actually are. And there's actually a number of even apps you can get for your phone that can help you track your migraines as well. A lot of times when people come to see a neurologist, particularly for headaches have just reached a point where they're really causing a lot of disability and disabling symptoms, and people will come in, take in a lot of information, and sometimes it's hard to remember everything that was said. So I think taking notes is a very important thing to do during your migraine visit, just so that you yourself can remember what you guys spoke about. This is why it's important to work very closely with your neurologist to find something that's the best fit, and to really give your neurologist the information about why things aren't working. Are you able to take it? Are you taking it at the right dose? Is it just failing? In which case, then you can work with your doctor to find the right fit for yourself.